Welcome to CAN Community Health. I'm Alex Redmond. Not long ago, there wasn't much hope for people living with HIV, hepatitis C, and other sexually transmitted diseases. And although we've made great strides in testing, diagnosis, and treatment, it takes a team of very dedicated and caring people to come up with creative programs and outreach services that offer help and hope. Joining us today is John Acevedo, CAN Community Health's Chief of Program Services, and CAN's Prevention and Education Manager, Yelitza Lemoine. John, let's start with you. How long have you been with CAN, and how have you seen CAN Community Health change with regards to helping people with HIV, Hep C, and other STDs?
Well, I've been one of the fortunate ones that have been working for CAN for about 17 years now. And yes, I've seen CAN evolve from the little small organization that it was with about 12 staff members to almost 250 staff members to date and growing. And programs have evolved, and one of the things that we've always been consistent with is ensuring that our communities are getting the necessary tools that they need to ensure that we prevent the continuing spread of HIV, STDs, as well as hepatitis C.
I think one of the things that you do with program services is you offer different types of programs. So you can break it down so that our audience can understand all these great supportive things that are out there. So let's talk a little bit about the peer program. Let's talk about PrEP, case management, all of that stuff.
Sure. These are programs that the organization has seen value in ensuring that our community receives these services so that we can prevent, as well as those that are diagnosed, we can keep in care by having a mentor type person like a peer navigator work with individuals that have been diagnosed and ensuring that they stay in care, as well as there is medication adherence. In other words, people understand the value of taking their medications every single day so that they can fight and beat the virus that they're diagnosed with.
So getting a diagnosis can be really, really scary. So what should somebody anticipate if they come in and they get diagnosed? Because a lot of people don't even want to come in and get tested in the first place because they're either scared, they may be embarrassed, or they just don't want someone to find out.
Okay, that's exactly what happens when someone first finds out. It's scary. They're getting tested. A lot of people struggle in coming in to get tested for HIV or even STDs. So that once they find that they are diagnosed, now to them it's scary because now they're entering into a type of medical care that they did not want to find themselves into.
Well, let's talk a little bit about the support that's there. You mentioned, we have the PrEP or the peer navigators. So what could somebody expect? Say, let's give a little scenario here. Someone comes in, maybe it's a senior, because we know that STDs, in particular HIV, is also on the rise with the seniors because of Viagra, and just people don't use condoms because they don't think they have to because they can't get pregnant. Right. So say somebody comes in, John Smith, it's a scenario, he comes in and he gets tested, and out of the blue, he's hit in the face with, "You are HIV positive, John." What happens then as support for him? What plays out?
Immediately, we link them up with a peer navigator. The peer navigator will help the person and educate them on what happens moving forward so that they don't find themselves alone and have someone that has been diagnosed and has been living with the virus for a very long time and knows the ins and outs of the care that they can expect. They mentor them and walk them through, then we link them into to see a case manager. Mm-hmm. The case manager will then do some type of eligibility to see if this person qualifies for some of the government-funded programs like Ryan White Care Act, and then get them enrolled into or make an appointment to see a physician that will then oversee their care for the long haul.
Let's talk a little bit about those programs.
Testing. When we talk about how people is scared to do testing is because they don't understand how easy it is to do nowadays the HIV testing. It is very accessible, it is free, and it's very fast. We at our organization, we are in continuous outreach efforts with the community mobilization, collaboration with other organizations and partners, and our main purpose is to reach the people when they are available and provide them with the right education for them to have access to their testing and education on HIV.
And as the boots on the ground, leading a team of people that you deploy, where do you go that you reach out to these people? Give us some of the places that testing may be available in their area.
Well, when we plan outreach, we have to take care of a lot of components. We want to reach the people when there is more important, when they're going to be, and the people who are more at risk. So for each area, we study the area, and then we plan the better time that the people is going to be available for us to offer the service.
So how do you determine, you guys, where would you be? Would you be at a like a health club? Would you be at a community center? Would you be out there in the fields with migrant workers? Where are you?
We will be everywhere.
Yeah, typically what we do, we apply a strategy so that we maximize our efforts within communities. Granted, it's been a long time coming, but we target our efforts to ensure that we're reaching those that are potentially at risk or putting themselves at risk, so that in turn we can diagnose them and get them into care immediately, so that if we get them into care, we can prevent any further transmission within the community.
So now there are certain things that are on the map that you use to determine where Can Community Health is most needed, to go into certain neighborhoods. I believe they're called hotspots. Can you describe how we find them?
Yeah. Hotspots are based in two types of data. That's what we call it. What we do is we take care of the testing area and the positivity rate, meaning where more people are more positive in the area, you're going to have a bigger chances to transmit the HIV.
So the more people that have HIV, that are living with HIV in a certain demographic, the more you're going to see a rise in new cases of HIV.
Potentially.
Definitely.
Yeah, that's a rule
Yes.
of thumb. But also, we look at individuals that report risk. People that report risk in a geographic area, we also look at that information to say if there's high risk in this area, then potentially this is where we want to be, and provide testing services so that we can capture some of those high-risk people or high-risk reports that are in those areas. So more than likely, we can end up picking up some newly diagnosed individual in those areas.
Well, we know that Florida tops the list for new HIV transmissions, and also we're in the top 3 of HIV overall in the states. We need to really change that. But how do you actually, when you go into an area, how do you figure out who is most at risk? What are some of the risk factors for having HIV?
Well, in this case, when Johnny was explaining, we'll see the risk factors. For example, let's get a zip code in Bradenton, 34208, to take an example. I'm not saying that's the one, but if this area we find a higher activity of drug users, then we make ourselves available at certain times of the week or a certain time during the month to do outreach that is going to be targeted especially for people who have problem with drug use. So that's the way that we do our target outreach.
And you know, it wasn't that long ago that I remember both you, Yalitza, and John were in a public service announcement about the opioid epidemic, and that was before it was as bad as it is now. And Can Community Health was the first one to have those different faces out there representing different demographics and different people. Also, we have the one in Spanish as well, so thanks to you guys. And if you would like information on getting tested or to find out when the prevention and education team may be in your neighborhood, you can call 844-922-2777. That's 844-922-2777, or visit cancommunityhealth.org. Stay with us. We'll be right back. Florida is #1 for beaches.
The Sunshine State also leads the nation for new HIV cases.
The opioid epidemic makes the fight against HIV and hepatitis C more challenging.
Minorities, women, young people,
And seniors are most affected by HIV.
But you can get tested.
You can get diagnosed.
And you can get treated.
CAN offers hope.
For information, call or visit us online.
Seniors, this one's for you. I'm Bob Trissolini. We don't talk about it, but seniors are at a high risk for HIV, hepatitis C, and other sexually transmitted diseases. You know that little blue pill that kind of puts us in the mood? Well, sometimes we don't practice safe sex. Many are walking around with HIV and Hep C and don't even know it. So protect yourself. You can get tested, you can get diagnosed, and you can be treated.
CAN Community Health. Welcome back to CAN Community Health. I'm Alex Redmond. We are joined by John Acevedo. He is CAN's Chief of Program Services, and Yalitza Lemoine. She is the Prevention and Education Manager of CAN. Yalitza, let's talk a little bit about outreach and how you and John choose people that you deploy out there to help people and give hope for those living with HIV, hepatitis C, and other STDs.
Well, I'm very proud to say that we have a very, very special team. Our team not only is very knowledgeable, because you need to have the knowledge, but it's very passionate. And not only is passionate, but they are very cultural competent. So not only we have people that speak Spanish, that speak English, that speak French and Creole, but we have people that understand all type of community in all the spectrum of LGBTQ community as well.
It's amazing. And I think we should go ahead and take some of the email questions, because as the show has progressed, we actually have people that write into us, and they write in from Florida and even beyond. So we're going to start off with a question right now, and it is, I caught an STD but don't want my partner to know that I'm getting tested. What can I do? And that is from JD in Venice.
Well, I will highly recommend it to come into our offices. We have one in Northport for your convenience and another one in Sarasota. You can come Monday to Friday from 9 to 5. Your text is going to be 100% confidential. So not only we're going to give you the result of the test, but also we're going to give you prevention information about it and how you can prevent later on more STDs.
All right, let's go to the next question here, and this one is from Caroline W. I've run out of HIV medication because I can't afford it. What help is available?
Well, there's lots of help available. What you should do is, when you do come to our clinic, if you like to come to our clinic, what we'll do is sit down with a case manager, and the case manager will walk you through. There are many, and we do have various programs that can assist you in purchasing, as well as through insurances, as well as medical services that can be provided to you. Understand that if you don't continue taking your regimen, what can happen is that you can create a drug resistance to the medication. So you have to ensure that you are taking your medication according to the way your physician has prescribed it to you.
So John, is taking your medication constantly, is it kind of like when somebody takes an antibiotic but they don't finish the whole thing, and then whatever they had can come back a little bit stronger because they build up an antibiotic resistance?
That is correct. HIV is a very unforgiving virus that you're taking, if a person's taking their antiretroviral medications, what can happen is the virus, as you're taking it, gets used to the medication in your system. The minute you stop, that's a way that it can then mutate and then create a resistance against that medication. And next thing you know, you can no longer take that medication at all.
All right, we have an email from Sam in Miami. Sam says his husband uses intravenous drugs. What should he do about a sexually transmitted disease?
Hi, Sam. Sadly, to be in a relationship with somebody who's using the intravenous drug, it make you at high risk to contract HIV, STD, and hepatitis C. I will highly recommend it that you will be screened regularly for all these. And prevention and education is always very helpful.
Alrighty, we have another question. It's, I don't have insurance, but I want to get tested. What help is available if I am positive? And that is from Sarah.
Well, getting tested is very easy. You don't have to have health insurance to get tested. The testing is done free of charge for anyone that comes through our doors, whether it be for sexually transmitted diseases, HIV, or hepatitis C. Like Yalitza had mentioned earlier, we do have a facility in Northport that we will be more than happy to sit down with you and provide the services to you in Sarasota, as well as various locations throughout the state of Florida. Just go on our site or call us and we will direct you to a site that's near you.
All right. We have another email from Lawanda in Sarasota, and Lawanda writes, my teenage twins, they're boys and girls, are sexually active. What advice can I give them? There's absolutely no information at their school. Is this a problem with getting information about HIV prevention and sexually transmitted diseases into the schools? One would think that, you know, you want your children for when the time comes to remain healthy and know how to use the proper tools to take care of their health.
Yes, Alex, sadly, it has been a continuous battle with the school system to bring more HIV and STD education within the education system. The sad part about that, it is the parents, many parents want this type of information to be available for the kids, but sadly, some of the representatives are still having a block into that. The trigger system of that, it is a problem that the kids don't have the right information and they engage into sexual activities, put them at risk to contract another's STD.
And of course, we need to talk about the fact that many people don't plan for their first time. I think that I've said this through the years, just from observation. People don't make it a day and a date and a time on their calendar and say, this is the day, the date, the time that I am going to have my first sexual encounter. Can you explain how it doesn't matter whether you have one sexual encounter or 50? You can actually get an HIV transmission your first time?
That is correct. It doesn't really matter. That's one of the reasons why we feel that youth should be educated and given all the tools necessary to protect themselves. Granted, we do agree that abstinence is 100% foolproof and you could not get diagnosed with anyone.
How realistic is it to ask people that are coming of age, that are teenagers and their hormones are raging, to remain abstinent? I mean, honestly, how realistic is it?
It's not. However, you do want to put that in your cadre of options for people. Abstinence. The second one would be be with one partner. If you are going to engage in sexual behavior or sexual activity, then be with just one partner. A mutual monogamous relationship would be the best way to also prevent. And if none of these two work for you, then the use of a condom would be the other method to prevent the spread of HIV and sexually transmitted diseases.
Have we been able to get CAN Community Health into the schools to talk about things to any degree at all? Is it happening at all?
At one time, we were in the school systems. We are not in the school systems as we were now.
But there's still some presence.
There is some presence.
That's
what
good.
we use our peer navigators or speakers bureau to go in and give their example, what has happened to them, talk about their life being infected with HIV, so that the students can see that it's not roses being diagnosed with HIV and living with the virus and having to take medications and having to deal with stigma and discrimination.
And of course, we have many people that work at CAN Community Health that are living with HIV. So, and that's a really important thing, is for people to meet these people and understand that there is hope. And all of these people are what we call in medical terminology, I guess, adhering to taking their
Correct.
medication. But really, for normal people like us, you know, our audience, it simply is about taking the meds that you were asked to take so that you can remain healthy. And, you know, anytime someone, I think, shares their story of living with HIV, it reaches so many people. That is so powerful.
Yes.
I don't know how those people need a medal or something for putting themselves out there, but we do have so many people that work at CAN that are great.
Yes.
And those are the people that you deploy out there.
Yes.
Who do you deploy out there? Who are these people?
Our specialist team, our peer navigators, I mean, it's a conjunction of a lot of people working behind the scenes and in front of the scenes. When people finish their job, our job starts, because that is the whole point of the outreach into the community.
And of course, always looking for volunteers, right?
We're always looking for volunteers. If anyone is interested in volunteering with CAN Community Health, just go on our website or call us, and there's a volunteer application, and we're always looking for volunteers to assist.
And I'm going to go ahead and give that number. So if you'd like some information on CAN Community Health, you can dial 844-922-2777. That's 844-922-2777, or visit cancommunityhealth.org. When we return, we'll find out how you can make a difference.
La Florida es la número 1 para las playas, pero también el estado de la Florida es la primera en la nación para nuevos casos del VIH. La epidemia de las drogas ha hecho esta lucha mucho más difícil, especialmente con hepatitis C y con el VIH. Las minorías, las mujeres, los hombres jóvenes y las personas mayores están más afectadas por el VIH. Ahora tú puedes tenerte la prueba, ahora tú puedes ser diagnosticado y lo mejor, puedes tener tratamiento, puede ofrecerte todo este servicio. Por favor, llámanos o visítanos en nuestra página del web.
Hi, I'm Dickie Smothers. You may know me as one of the Smothers brothers, and then again, maybe not. That's not why I'm here. I'm here to talk to you about something serious. Hepatitis C. No laughing matter. It can lead to cirrhosis of the liver, even liver cancer. Baby boomers are most at risk. You could have Hep C and not even know it. You can get tested, you can get diagnosed, and you can get treated. Hep C can now be cured.
For information, call or visit cancommunityhealth.org. If you just tuned in, we are talking about the many ways CAN Community Health helps people all over Florida and beyond to learn about HIV, hepatitis C, and other STDs. Yalitza Lemoine and John Acevedo of CAN are sharing great information of help and hope. Well, again, thanks for being here, you guys, to share all this great information. And we talked about many things, including how people can get help if they can't afford medication for any of the above. HIV, Hep C, STDs. There is help out there with the Ryan White program, 340B program, case managers, peer navigators, people living with HIV that can help them. But let's also talk about specific communities, because we have many people here where English is not the first language. Mm-hmm. We have migrant workers, God bless them, that are out there, you know, making our lives much easier and providing great quality help for us. How do we reach these people where they don't speak English, and is stigma a problem?
Well, we reach this community by having within our group special people that speak not only the language, but they are competent as well for work with the migrant population. The migrant population is very special population because they are being segregated. You know, these people are suffering from fear, the fear that the government is going to go behind them, they are illegals. So all these factors make them a little bit more difficult for them to reach access to care. So for that, we go in depth into the migrant camps, and we offer services, free services in Spanish with materials made in Spanish exclusively for them.
And what about the people that you send out? That you have Spanish-speaking people that are there to help as well. What about there's Creole-speaking people are definitely a group of people that you try to reach out there on the street. Do we have some Creole-speaking people that can help?
Yes, we have in our group people who speak Spanish, English, Creole, and French as well.
French as well. That's amazing. So where do you find that the most Creole-speaking people are in the state of Florida right now? In the Miami area or the
That would be
Sarasota
down in
area?
the South Florida, Southeast Florida of the state. And because there is large Haitian population, Haitian communities in that area. The majority, and that's where the majority are concentrated, not so much. We have a handful over here, but not as much as down there.
So how is it different that you would reach the different cultures? Like if you're trying to reach the migrant workers and or Spanish-speaking people, where would you go to reach them? Because obviously they may not know to come in to a clinic or one of CAN's partner locations or a testing facility to get tested. How would you reach them?
Community collaborations is so important. So we are not working alone. We work along with a lot of other organizations. Knowing your community is the most important step before you are doing any type of outreach. So for us, it is very important to have this collaboration with other partnerships so they can tell us how, in which places, at what time, the highest concentration of the population is going to be available for us to be able to reach them.
Let's talk about stigma. How is stigma different? Is it different with people in the Latino population? Is it different to other groups? And how is it different?
Yeah, stigma plays a huge role in our world because dealing with the different populations, stigma affects certain communities and every community differently. A perfect example, the Hispanic community. When it comes to dealing with men within the Hispanic community, there is a stigma about identifying as gay. So to them, they don't come out or report that they are living a life of gay or having sex with men because they know that within their own community they're going to be ostracized or discriminated against. And then same thing plays out within Haitian communities. And then if there's a diagnosis of HIV, then there's another stigma because now clients don't want to come in and receive services.
Let's talk about if someone comes in for a test, but briefly because we're almost at the end of the show. If someone comes in for a test, they're worried about anonymity. They're worried about somebody not finding out about it. So should they be worried? And is it hard to get a test?
No, I will tell this with all my passion. It is easier than people believe. It is fast, it is 100% confidential, and it's free. And you're gonna have the right people sitting in the other side of the table helping you to go through all these questions and make you feel easier. So take the opportunity, come to us, and find out your status.
And an HIV test is just a finger prick now?
Yes?
That's correct.
Finger prick. All right, so go out there and get tested. We want to thank you for taking time out of your very busy day to join us on CAN Community Health. And remember, you can be the one to make the difference.